Hello, my name is Christina Patton, and I am one of the pre-nursing advisors here at Wayne State. Welcome to the pre-nursing essential session. So this is a very needed and valuable part of your onboarding into Wayne State. And as a pre-nursing student, there's always so much nuance and so much complexity to this specific program. So we want to make sure we go through it. You feel well prepped for your application coming up. You know what prereqs you need as well as some expectations that we do have for pre-nursing students. So let me go ahead and jump in. Again, if at any point any of this information is confusing, you want some clarity, please definitely keep a list of questions. You can always email those over to me after you finish watching this. As you see, this is our agenda. We'll go through some expectations that we have of students as well as our checklist for pre-nursing. Our checklist is available on our website. I have a brief activity that I'm going to talk through because we don't have anybody present. We'll go through kind of why nursing, and then I'll talk about why that specific activity is very valuable to your application. We'll go through the different Bachelor's of Science in Nursing or BSN programs that we have here, as well as the application package for 3 of those programs. At the very end, we're going to talk about being competitive versus being an admissible applicant. We all want you to be competitive applicants versus just admissible. So we'll go through those differences. And then we are going to do a mini quiz and review. So that quiz and review is our post-essentials or post-session survey. I highly encourage you all to fill that out at the very end. That is the only way I know that you came to this, and I am able to add you to our pre-nursing listserv, which is our email list where I send updates about accountability groups, which I will talk about as well, about different events that we're doing, reminders, stuff that you all need to know throughout the semester. As well as getting a copy of these slides so that way you can refer back to them and the checklist and anything else that we give you, like a GPA checklist as well. So please feel free to fill that out. All right, so on to some student expectations. These 4 areas are kind of our biggest expectations. When it comes to appointments, if you need to cancel, we prefer you do that instead of no showing. That cancellation can be an open appointment slot for students who can get in for that day. Usually around very busy times like registration, the beginning of the semester, we are booked for a month out because we have so many students trying to get in and see us for classes, for course recommendations, for different situations. So we highly just recommend, it's a courtesy to us and to your fellow peers, to just cancel. Please let us know in advance as well if you're able to. You can send us a quick message. When it comes to professional emails, this is just something that we kind of learn as we go through college, but especially in your first year, always put a proper subject. And then always put a greeting, and please use complete sentences as well, and just let me know kind of what the message is about. Sometimes we get messages that seem a little bit more of texting, and it's a little difficult to help the student if we don't know what you are saying. The next thing is just really understanding your courses and your pathway. We want you to take accountability, but also to be very autonomous in your choice of the kinds of classes you want to take. For prereqs, you have very limited pickings, but for general education courses, that is up to you as the student to choose that. We do not recommend choosing the easiest or an online class that you feel like is the easiest. Choose something that is interesting, that kind of widens your variety and teaches you a new perspective. Um, I know that's not going to be everybody, so you got to choose what you can. With that, we also want you to really understand your application package and your individual pathway to nursing. So all of you will have a similar prereqs that you need to complete as well as general education courses. You may come in with varying degrees of AP credit, dual enrollment, transfer credit from other colleges. So your path is going to be very different from somebody else's path. Just want to make sure that you are not comparing the length that it is taking you to complete your prereqs to other students. Our normal length is around 2 years, which you'll see reflected in our pre-nursing checklist. And if you want to complete all of your prereqs in a year, it is very difficult and not necessarily something we recommend. And I'm happy to have an individual conversation on that. The next thing is exploring career goals and other pathways. I really encourage you all to kind of research that and explore it before you come to us. This is just kind of an expectation for all pre-nursing students. Yes, we are applying to nursing, but we want you to explore other things. You are exploring pre-nursing as your major, and there is a reason for that. by the winter that you are going to be applying for your program, we want you to have a backup plan set in place. So that means a different major, degree program, different pathway, maybe a different healthcare program or healthcare career that you're interested in. This just rounds you out as an individual, kind of gives you a good idea of why nursing is why it is for you. Like why are you choosing that specific profession over becoming a doctor or over becoming a radiologist? There's so many different career paths that we can explore that may be similar in nature, but give you different levels and have different levels of education. So we just want to make sure that that is something that you're also looking at. All right, so this is our checklist. As I said, it is on our website, and once you fill out the Post Essentials survey, you will be able to get a copy of this that is hardcover. On the back of this, we have our skills assessment as well. It is not reflected in here because our skills assessment is going to be a verbal thing that we'll do in a second. But this is pretty much your guide for progression here with pre-nursing. We have it set up to cover your first year and your second year. The checkpoint is going to be the summer between. Through this, we kind of have a little bit of a suggested timeline of when to get started on your application. I always recommend begin your first year. Start developing your leadership skills, your diversity engagement, start developing your ability to respond to challenges that you face, as well as where you want to do your volunteering. As you'll see, attending Essential session and starting this checklist is your first task on this checklist. So if you are here, you can go ahead and check that off. The next thing is it is so important to have a one-on-one advising appointment with either me or Helen Wilson. We are the two pre-nursing advisors here. Helen Wilson is an amazing pre-nursing advisor and she gives wonderful advice. We both want to set up a plan of work within your degree works so you have an idea of your own progression for your prereqs. If you do not have that plan of work by the time we get to registration for winter courses in November, it is kind of up to you guys to figure that out because we only have so much availability and time out of the day to answer the hundreds of emails we get. So please do that beforehand. Be pretty proactive about it. We'd love to sit there and help you make a winter semester and kind of figure out courses and plan it out that way. Cool. This again is a guide. You don't have to do everything on here. Everything that I highlighted in red, I do recommend getting done. So you'll see in your first year, your second semester, in your winter semester, we look at parallel planning. So that is our fancy term for backup plans. Again, like I said, it's an expectation for students, something we want you to have. It kind of just rounds you out. You explore your career goals, you kind of know why. Um, but yeah, so from here, we do use this within your appointment. I'm happy to check it off for you, upload it, send you a copy of our completed one. This is something we will continue to refer back to, especially as we get into your second year, which is your application year to nursing. Um, but yeah, okay, and keep going. Okay, so I'm going to make this brief. This is going to be about email etiquette. So professional communication is a very, very big thing in college. The way that you email others and the way that you present yourself is going to show a lot on who you are as a student. So you want to do that in a professional way or in a way that sets yourself up for success. Always make sure you have a concise subject. So if you are emailing me about courses, please just don't put courses in the subject. You can put winter 2026 courses, bio course, need help. Any of that is perfect. Courses is very general and very vague. It does not immediately catch my eye. So if it's something that is urgent or it needs attention within the next day or two, definitely put that in there. The next thing is please don't send duplicate emails. If you send me one email, I have an automatic response because I get at least 25 emails every hour. You will get an automatic response to that and it'll take me probably around 3 to 4 days. It usually, if I'm able to get through my emails quick without a lot of kind of flood into my inbox, a day or two at most. If you send me duplicate emails, and by that I mean if you send me one email, it's in one email thread, you don't hit reply to that thread, you go in and you hit new message, and you send me another message and another message, it's going to take me so much longer to kind of get through because you are flooding my inbox with more and more. Next thing is please don't email as if you are sending a text message. I am very much able to kind of read that text lingo. It's something that I'm used to. I am Gen Z myself. But not everybody within academia is going to be able to do that, nor will they want to. So make sure that you correctly and professionally address the recipient of the message. You can just say, "Hi, Christina," for me. I am not Mrs. I am not a doctor, and I am not a professor. You can put advisor if you would like, but feel free to just put my name. Always end with a signature so we know who we are talking with and who it is coming from. We can fully read your name, but that is just proper within emails. And make sure you use full sentences and punctuation. And again, use appropriate language, please. We have two messages that we will go through, which is one that is professional in nature from a student, and the other one which is not professional from a student. It may seem sincere, but again, it is not professional. And again, before you send us an email, just please ask yourself really quickly, this is something that you can research or search up on wayne.edu or that you can find on Google on your own before coming to us. We sometimes get very, very odd questions from students, and I fully understand and I will take time to answer them. But again, just for appropriate use of skills, just search it up first. All right. So these are our two examples. As you can see, the big X and the big check, we know which one is which. So from student A, they do not put a subject in there and they address this as, "Hey Queen." That is an inappropriate way to address anybody who works in academia. We are academic staff. You do not say that to your professor who are faculty. You do not say that to older students as well. "Hey Queen," that is a very friendly term to use. And you do not end the email by saying "Thanks, Batty." That is not appropriate. Again, from student B over here, you'll see "Hi." Did not necessarily put my name, which is perfectly fine. It's still a salutation. Used proper sentences, asked exactly kind of what they were needing and the question that they had, put a subject up at the top, workshop 529. I was able to figure out, okay, so this is going to be about the essential session that we're having on May 29th. Okay, cool. And then ended with a dash, but also their name, which this is a little bit more informal, but it's still a lot more professional than student A's. Cool. Glad we were able to go through that. So this is our skills assessment. Like I said, this is attached to the back of our pre-nursing checklist, and these are just some questions that we have. All of these questions are the essay questions that you will need to answer as part of your application to nursing. Your first one is going to talk about leadership and your leadership qualities. What experience have you had where you've been able to showcase leadership, problem solving, ambition, inquisitiveness, all of those. The second one is going to talk about your diversity engagement, so your meaningful interactions with people who are different from you in any way. That could be through cultural competence, that could be through learning a new perspective, or learning how things are different for somebody else. Grit and resiliency is going to be your third essay question. I'm so sorry if you can see my Teams pop up. I can't get that to go away. That is going to be talking about anytime that you face a challenge in your life. That could be through school, something personal, something social, really does depend. They want to know how you grew from that experience, how you pretty much interacted or treated that experience as a challenge. And your fourth one is going to be about your community service. So why did you choose that specific place to volunteer? Why are you doing that as you're volunteering for nursing for your application? And how is that experience going to kind of relate back to nursing? How did that make you want to become a nurse? So these are just some questions that I would sit there and ask yourself and think about before you go into those essays. We have an essay workshop as well that kind of addresses this, and I'm super happy to help you through those essays if need be. Yeah, this is a good start. Okay. Finding your why is another big thing for essentials, especially for your nursing application. Why do you specifically want to become a nurse or study nursing? What has nursing kind of given you? Why is this the field that you chose? It is a very difficult, at times, emotionally exhausting and physically exhausting role. If you work in a very one-on-one intimate setting, depending on the department, if you work in oncology, pediatrics, the NICU, the ICU, it can be so a lot. It can be very, very a lot. It's emotionally taxing and it is so much to kind of take care of somebody in a very vulnerable and kind of intimate situation. So just check in with yourself a little bit. Why is this the path that you want to go on? nursing school, especially Wayne State's nursing school, is very difficult to get into. It's very, very competitive. That is not something that we shy away from saying with our students. So why are you going to be taking a year or two to go through, get through these really difficult courses and do this entire program? Is it something that you feel a strong connection to? Is it something that you're motivated by, or is it super meaningful to you? Do you have a personal connection to why you want to do nursing? What are some of your goals and some of your challenges with this, with pursuing this pathway? And can you fully define it and reflect on it? If you're able to do these things to find what your why for nursing is, then you might be ready to apply. So we like to take a moment to always learn a little bit more about the different kinds of nurses. My mom is a licensed practical nurse or an LPN. She did 2 years of a technical college, got an associate's degree, took her NCLEX LPN, and she's been an LPN, I believe, for 13 years now. It might be longer than that. I'm gonna be so honest. Um, but some things that we like to talk about with our students are the different kinds of nurses that you can be, the different ways that you can graduate that and keep building on it, as well as the different kinds of education that you may need for it. So all of us here, we are going into a 4-year university, Wayne State University, with the intent of applying to a Bachelor's of Science in Nursing program. So that is a BSN. This is a bachelor's degree program. Wayne State does not offer associate's degrees. We do offer Master's of Science in Nursing, PhD in Nursing, and also a Doctor of Nursing Practice, which is an NP or a DNP. But to achieve those three graduate level programs, you do need an undergraduate degree, which is a bachelor's. A Bachelor's of Science in Nursing allows you to then take the NCLEX RN, which is for registered nurses. And once you pass that, and you get licensed, you can start working as an RN. Okay. Nurses do some of these things here, conducting physical exams, taking detailed healthcare histories, doing wound care, checking patients' vitals. A lot of this, they do a lot of coordination with other care or care providers and specialists for their specific patients. Nurses can work in any one of these areas. There's a bunch of different places. I try to list as much as I possibly could. They can work in hospitals and clinics, offices and schools, pharmacies. There's flight nursing, which is working within a helicopter. You can work in an ambulance, a home health care or a senior living care facility setting. Travel nursing, legal nursing, forensic nursing. There's a variety of different kinds of nursing that you can do, as well as different kinds of nurses. Like I said, LPN is a technical, more like associate's level program. Registered nurse, you can have a bachelor's degree in it and associates in it. There's an APRN, so an advanced practice registered nurse, and then nurse practitioner. There are different subspecialties that you can do. So there's psychiatrics, there's pediatrics, there's oncology. So really, I recommend if there's a specific kind of nursing you're interested in, just pursue it. Go look at it a little bit more. We usually do a couple of sessions every single year about different careers in nursing. We've had nurse anesthesia come and talk. So we have a DNAP program here at Wayne State, a Doctor of Nurse Anesthesia Practice. And we had their students come and talk to our students about that, what that looked like, how they got there, the admissions, and also what can you do with that degree. We are going to be having aesthetic nurses come and talk from the College of Nursing. They're talking about Botox injections, how they got their own practice, and how some students might be able to get into that. And this winter, 2026, we are going to have pediatric nurses come and talk about working with kids. So if there's a specific kind of nursing you're interested in, just let me know. And I'm super happy to kind of do the work and see if I can get them to come and talk. Right. So we are going to go into the different BSN programs we have here at Wayne State. The first one we're going to talk about is traditional BSN. So this is the one where all students who are coming in with either little college credit or no college credit, if you're going for your first bachelor's degree, that is the program that we are going to be applying for. It is a 3-year BSN program. They do not do spring summer courses. They have fall winter only, and they have specific classes that you take. There is no way to accelerate this program to be less than 3 years once you get in. That is simply the program nature. Below that, we have the accelerated BSN, or as we call it, the ABSN program. This is for students who have a first bachelor's degree in any subject area or are on track to earn their bachelor's degree by the time that they do apply. It is an accelerated program. It's 5 semesters or 20 months. You start in the spring summer, while traditional BSN only starts in the fall semester. ABSN and Veteran BSN only start in the spring summer. Both of those programs you go in as a cohort, so Vet BSN and ABSN. You guys take classes together. Veteran BSN is for students who are veterans or eligible military affiliated students. You need your DD-FM 214 or your LES to show proof. Again, it is accelerated, it is 5 semesters. These are the 3 different programs that we provide advising for and that we look into. There are other programs available here at Wayne State for BSN. I do recommend scanning one of these QR codes and going to the info meetings that they have on their website and learning a bit more from the nursing school about it. So we're going to talk about the application package specific for those 3 programs and those 3 only. Traditional BSN, accelerated BSN, and veteran BSN. One thing to note that I apparently did not change on this one screen was veteran BSN does not require a minimum 10 hours of healthcare related service experience. There is the DDFM 214 or the LES that you must turn in to cover that area. Accelerated BSN and traditional BSN will have to cover all 3 of these. I think I have a note later on in this slide. So going into those prereq courses, this is a table that breaks it down for all 3 programs. A couple of things to note, you do need a minimum C or better grade in each one of these classes for it to count and be accepted by nursing. If it's a C minus or lower, that is counted as failure to pass that class and you will have to retake it. We previously had a repeat policy for traditional BSN and accelerated BSN. There is no longer a repeat policy against retaking prereqs for all 3 of the programs. So as long as you retake that course and you get a C and above, it will count for your program. Everything that is red with a little star on it means that those courses have prerequisites. You have to do those before you take them. They cannot be taken at the same time as the course. That is a common question that we do get. It is not a co-req, it is a prereq. So that knowledge that you learn in that course is paramount to doing well in that class. One thing to note for traditional and accelerated BSN, these courses do expire after 10 years. So if you are coming in with a second degree or you're coming in with some college credit from a couple of years ago, we just need to double check and make sure that we aren't past that expiration date. We really recommend meeting with us individually to go over that. Prereq courses for veteran BSN expire after 14 years, so they have a bit of a longer timeline than ABSN and TBSN do. And then CLEP is the college level examination placement or program. It is through College Board. You can earn college credit for one of these prerequisites. You do have to pay the pocket for that exam, and some students are successful, some students are not. Again, that is something that I do recommend speaking with us individually on if it is something you want to pursue. Now to go into the prereq courses, there are 8 of them. For traditional BSN, we'll just focus on that one right now. English 1020 and your quantitative experience, which is a math class. Those are general education courses. So English 1020 is your BC, your basic comp, and QE, quantitative experience, is your math course. From those, we then have intro psychology, which is PSY 1010 or PSY 1020. You can do either or. And then after you complete that course, you are then able to take developmental psychology, which is PSY 2400, or PSY 2410, which is health psychology. You cannot take developmental or health psych until you have intro psychology completed. Below that, we have Bio 1510 and 1511. So Bio 1510 is basic life mechanisms. That is cell bio or human bio. That is a lecture course and it has a co-requisite, which is the lab 1511. We do require that class to be completed. Has to be done. For some students who come in with AP credit or dual enrollment, you may have a placement or a prior credit that allows you to go into that class. If you do not, you do need to take a placement exam or the prerequisite, which is Bio 1050, Intro to Life. If you do not have that completed, you cannot take Bio 1510 or 11 here at Wayne State until it is done. That class is actually a prereq for another one of our prerequisites here, Bio 2870, which is Anatomy and Physiology. It is a 5-semester course that is combined with anatomy lab and physiology lecture. You cannot take the 2 bios concurrently or together in a semester. They have to be taken one at a time. And below that, we have two chemistry courses. You'll see that the chemistry is the same for all three programs. You have two options, a survey of general chemistry, which is Chem 1020. That does have a math prerequisite requirement. So either an SAT score, math score of 490 or up. You need either Math 1000, a intro statistics or statistics course. You need college algebra or algebra course, some level of math to get you into that. Personal finance planning, astronomy, um, there's some other ones. Detroit by the numbers, none of those math classes will count for Chem 1020. It has to be a traditional math course. Um, but besides that, you can also do Chem 1060, which there's no prerequisites for this course. You can just go into it. It is a survey of general organic and biochemistry, so it is a mixture. It is pretty accelerated. Um, if you come in with a higher level chemistry like Gen Chem 1, Orgo 2, Biochem, we can accept that in lieu of this chemistry because it is a higher level. But again, this is something, please speak with us on a one-on-one basis. And then below that, we have NFS 2030, that is nutrition in food science or nutrition and health. You will see that some of these prereqs are pretty similar across the board. ABSN and vet BSN have slightly different prereqs compared to traditional. So social inquiry and cultural inquiry, that is a social science and humanities course. So two different gen eds. You'll see the psychology is similar, anatomy and phys, chemistry, nutrition is similar. The only two additions is Bio 2270 and 1. That is microbiology. That is a requirement for the ABSN or vet BSN like prereqs. The prerequisite for that class is basic life mechanisms, Bio 15, 10, and 11. And then you'll see NUR 2030. So that is pathophysiology. That is a nursing course. Traditional BSN students usually take that in their first year of nursing school. For ABSN and vet BSN, since it is accelerated, you will do that before you start the program. But yeah, these are the prereqs. There may be some exceptions to it just based on individual things, but again, just please speak with us about it. All right. So this is DegreeWorks. We always want to set up a plan of work with all of our students. That's why we really kind of push to go in for a one-on-one advising appointment. This is something that we will set up and you are able to add to, take away from, put new things in there, move the semesters around. This is for a traditional BSN student, or pre-nursing student on track to apply to traditional BSN. As you'll see, it takes 2 years. So your first semester is going to be fall 25 and then winter 2026. We start with the level 1 Bio 1050 bio, and then from there we build into the next level. We like to put at least one science in for the semester. We don't necessarily double up on the sciences. A lot of the times we see students don't have the best success with that, and we just want to make sure that we're kind of doing something that works for students specifically. Again, we recommend aiming to get to 14 or 15 credits each semester. That does mean adding in general education courses. Do not expect to just take prereqs. We will do your gen eds. And if we finish your gen eds, we will take classes for a minor or a potential major as a backup. That is something that we do not kind of allow you to do. Like you need to be full-time, 12 credits or more for financial aid purposes. And if you aren't, you may get a financial hold that may impact your scholarships. And we don't want that to happen. So again, this does vary per student, and we want to make sure that this is used as a map for your progression and your path forward with prereq courses. If you do not pass one of your prereqs and we have to repeat or retake, you will need to use your summer semester, or you will have to take two hard sciences together in the next year in order to be back on track. For traditional BSN, ABSN, my bad, veteran BSN, there are specific dates that we do need prerequisites completed by in order to apply for that application year. That is something that we do talk about in our application workshop, so I highly recommend coming to that as well. All right, so for GPA, this is another aspect of that 8 prereq course requirement. You do need a minimum prereq GPA of a 3.0 or higher. So that does not mean your cumulative GPA. While that does still need to be in good standing, please aim for everything above a 2.0. For application or for applying to traditional BSN, ABSN, or VET BSN, you do need to have a 3.0 or better. So in those 7 or 8 prereqs that you see on the screen back here, from all of these, For ABSN and Vet BSN, whichever ones you have completed will count towards your specific GPA. For traditional BSN, it's all of them with the exception of your QE, so your math class. You truly just need to get a C or better in it. We recommend getting around a B plus or A minus minimum in those courses. Aim for all A's. A competitive GPA is going to be a 3.5 and up around that area. A minimum admissible GPA is going to be a 3.0 and up. Okay. This is something that we will do with you guys as you get your courses completed. It kind of defeats the purpose if we don't really have any grades to do our GPA check with. So we just want to make sure that it's actually realistic and not just kind of a projected GPA. And again, this is for reference only. You do not submit this. You do not submit this as part of your application. My bad. There's no place for you to submit it in the application portal. So this is just for your own reference. All right. So that is one part of our application package that we covered. So that is part one, 8 prereq courses and that minimum 3.0 GPA. And as I have noted here, for potential VET BSN students, you don't do the 10 hours of healthcare related service. We're now going to go into our 4 short essay response questions. Again, we're not going to extensively go through each and every aspect of this. This is stuff that we do learn along the way as you are a pre-nursing student. And we do talk about extensively within our application and essay workshop. Like I said, these are the big 4 topics for each one of those essays. They are short response. So that means you do not write more than 250 words per each response. That's like 2 short paragraphs. You need to be very concise and to the point, but you also have to relate yourself. You're writing to faculty reviewers, so you want to make sure that like, you are fully conveying kind of what you want to convey and you're answering those questions fully. We have recommended resources. We do an essay workshop every fall and winter. We have essay writing drop-in hours at our accountability groups where you can get hands-on help with that. There is the Writing Center at the second floor of the undergraduate library. And you can always send whatever you have to either me or to Helen Wilson. We are super happy to give you any feedback on your essays. With the patient care and healthcare related service experience, that is going to be your 4th essay. That relates back to your 10 hours of volunteering that is required. For VET BSN students, this prompt is slightly tweaked for you all. You are able to talk about your military experience or healthcare related service experience if you did work in a healthcare field. Right. So those are your short essay response questions. Like I said, it's a very brief overview of them, but that is the second part of your application package. Your very last part are going to be your hours or your 10 hours of volunteer experience, or for VET BSN, your DDFM 214 and LES. For healthcare related service experience, you have to complete a minimum of 10 hours. I don't recommend just doing 10 hours. Don't just do the bare minimum and just to do this to check off a box. Definitely take your time with it. Be very intentional. Nursing does have a preference for healthcare or patient care specific experiences, but they do accept community health services like volunteering at soup kitchen, food pantry. They have this extensively on their website, so I do recommend taking a look at that and looking at it. For volunteering, it has to be unpaid. If you work in healthcare, if you're an MA, a CNA, a PCT, you cannot use your day-to-day position. It must be an unpaid area. And for this to count for your application, it has to be done within a year of your application deadline. So if you are a pre-nursing student applying for a traditional BSN, let's say your date to apply is May 1st, 2026. Anything that you've done May 1st, 2025 up until that point of 2026 will count for your application. If you did it before May 1st, 2025, let's say in January or August of 2024, that is not accepted or cannot be counted on your form. We have a couple of volunteer work, like stuff that you can go to, such as the Volunteer Hub. I have a list of recommendations, so if you're interested, just let me know. I'm super happy to send that over. We do a patient care panel every single fall, so we have volunteer coordinators from the big hospitals come and speak about volunteering at their program. It's a really great place to learn a little bit more. Again, with this, be intentional. You are going to have to connect why this specific experience has contributed to your desire for nursing. So choose wisely. It is up to you to find this and to complete it. We are happy to help and give recommendations, but we do not provide volunteer experience. Okay? Cool. So those are the three areas of our application package. Again, to reiterate, your application to nursing only consists of three things: your prereq courses and your minimum 3.0 GPA, your essay response questions, and then your 10 hours of volunteering. Those are the three parts that we have to complete and get done in order to apply and have a complete application to nursing. So to go through some myths versus facts, these are some questions that we usually get from students around this. Um, is there an interview as part of your application? If you are applying to traditional BSN or accelerated BSN, you do not have an interview. There's absolutely no interview as part of your program or your application. If you are applying to veteran BSN, you do have an interview. That is something that you do need to prepare for. I'm super happy to help and give you some recommendations for that. But you do have an interview. For letters of recommendations, there are absolutely no letters of recs accepted for these programs. It is not a requirement. There is no place for them to even be turned in, and if they are turned in, they are probably not going to get reviewed, and they will not be used as part of your admissions or your application package that they look at and review. There is no place for you to submit a resume. It's also not required. You can submit these, but they will not be reviewed. So please just don't do it. Um, Cool. Okay. If you have any other questions on some things that you might think might be a part of the application, just let me know. One thing that I should probably put on here is there are no exams or like tests that you have to take in order to get into the program. I know some community college or technical schools have like the HESI exam or the TEAS exam. We don't require that for the BSN. Okay. So we're getting into our favorite part, competitive applicant versus admissible applicant. So between these two, a competitive applicant is someone who aims to get a 3.5 plus GPA and prereqs, does not necessarily get that 3.5, but let's say they do, you aim to get a 3.5 and up on all of them. They really utilize learning support resources. They're taking accountability for their academics. They're making sure if they don't understand science, if they don't understand what the bio professor is saying or how to study for the exams, they are taking the initiative to go and find out what those skills are. And they do this for both their science and their non-science classes. They stick to doing one science a semester. They know their limits. They know if they try to cram and take chem and bio together, it's not going to end very well. They aim to take no more than 15 to 16 credits. You can do up to 18. Anything over 18 credits you pay out of pocket for. We don't recommend that. We recommend stick around that happy medium. You are already doing a lot of classes, so that's like 5 to 6 courses in and of itself. Half of these classes are going to be hard. They're going to require you to do a lot of studying and preparation outside of class time. And you might work a job. You might have other responsibilities. You might want to have a social life and to be able to, like play in a sports team. Um, to fully balance and manage your time where you have at least an hour or two a day where it's a little bit free, doing more than 16 credits is not going to allow that for you. I know it from personal experience. It does not always give you the best options throughout the semester. These students explore why for nursing. They have a very good idea of why they want to do it. They know what their career goals are. They know that they want to work with pediatrics. They know that they want to work in oncology. They take time to really research nursing. If they want to do nurse anesthesia, they know what they need to do, the prerequisites they have to get done. They at least look at those and they understand the role. They know kind of what places they can work as a nurse and they have a good idea of the salary because that is also something that we kind of expect you guys to look at. They have a plan in their degree works. They meet with us at least once a semester so that we were able to update and kind of check in and see how things are going. They do also have a backup plan before they apply. So they look at other majors, other degree programs, other nursing schools, or other career pathways. This makes for a very successful student because they feel like they are covered and supported no matter what the outcome is of their decision. They use the checklist, they use the application timeline we have in the application workshop. They make sure that they're getting their things done and turned in on time, as well as giving themselves a lot of time to receive feedback and review on essays, to have time to be able to go through their volunteering. And just a shameless plug, we do see a lot of these students coming to these pre-nursing workshops, coming to accountability groups, regularly involving themselves and making sure that, they're being a peer support, they're being a peer mentor. As well as they're just showing up and they're gathering the information. Everything that is catered to them, they do come to, and it is greatly appreciated, also seen, but it does also help them a lot. All right, so an admissible applicant is mainly a student who gets average 3.0, so that's Bs or better on their prereqs. They aim for B's in all their prereqs. They're just trying to get through, finish out the semester, finish the courses. There's absolutely nothing wrong with that. But another aspect to this is that they don't necessarily utilize those learning support resources. Even though they may not be passing or doing very well on their exams for bio, they are thinking, I don't need tutoring. It's fine. I just got to get through. I just got to pass. Unfortunately, C's do not earn acceptance into the program, so you want to make sure that you are kind of going above and beyond. You are doing really well in these courses. They don't come to really any pre-nursing workshops or essentials. They haven't done this session here. They do not know what's expected as part of their application. They get to the winter before their application is due, and they see their friends are applying, and then they come to us and they're like, I didn't know how to do all of this. That is a very unprepared student who might be admissible, who might be able to put together an application in a month or two and submit it, but does not mean that it is a competitive or very quality application. They don't come to accountability groups. We get it. The times sometimes do not work for everybody, but they don't kind of make a clear effort to try to connect with other pre-nursing students, to make those connections in courses. Another thing is they barely see us. They come and meet with us maybe once or twice, which, yeah, you can totally do that, but just check in with us at least, you know. They don't have a plan of work in degree works. They have absolutely no idea what prereqs they need to get completed next. They don't take the initiative to look at their degree works and to kind of figure it out or to ask. With that, they also don't have an application timeline. They don't go to the application workshops, they don't go to the essay workshops, and they don't necessarily work with either me or Helen to make a tentative timeline to get things completed. They are just kind of, free floating. They double up on sciences in one semester. They take more than 16 credits a semester, they overload, and sometimes that means that their semester is not very successful. They may get low grades or fail class even. And one of the biggest things is they don't necessarily take time to explore nursing or any other career goals. They're kind of set that nursing, that is all that I want to do. Even if they're not finding success in applying to the program, that is not something that we recommend for a competitive student. You need to be able to adapt and to have a backup plan and to work well under pressure. And if that is something that we're not able to do, then we may need to have a realistic conversation about it. But these are the two differences between a competitive and an admissible applicant. Okay, thank you guys all for your patience. We have a couple of things. This is the mini quiz. I'm gonna pause for a second. If you want to take a screenshot or if you want to like scan it, there should also be a link available for you to fill out at the end of this. But another shameless plug are accountability groups. What is an accountability group? This picture right here is only for fall 2025 sessions. We will have a completely different schedule for winter 2026, and we're planning on doing this just about every semester. They are peer-led by students who are pre-nursing students. They are weekly groups where you're able to just join throughout the week. You can go to one, you can go to them every single week, you can go to all of them if you want. It's just a great place to ask about questions, to build community, to ask a peer who is a second year pre-nursing student who is preparing their application about any questions you may have. Where did they go to volunteer? How did they get through their courses? What are some good study tips? They have some great worksheets on time management, on studying, on setting goals for the semester. And this is usually where me and Helen Wilson come and do drop-ins for essay help, for application help. We do some self-care stuff. All of this fun things. But again, this will be updated. It's usually on our website with the current time, so just take a look. All right. So once you complete that post-survey quiz, you are going to be added to our pre-nursing listserv. You will get workshop updates, small group advising, or those drop-in updates, and then any upcoming events that we do have. I would really recommend scheduling a one-on-one appointment after this with either me or Helen. We can review your checklist. We can make sure you have a plan of work in degree works and just check in on any questions you may have. If you're going to be applying this upcoming year, or you're just, want to get ahead of the game, start to think about your application timeline and your package. When are you going to get things done? You can check out these two links here, the application workshop and the essay writing workshop. It links back to our website. But those times should be available up there under workshops and sessions. So I always recommend checking back and finding it there. But thank you all for your patience and for getting through this with me. If you have any questions, like always, you can just send me a quick message, send me an email. I'm super happy to answer them. But yeah, I hope this information was very valuable and needed. Um, super, super happy to add more to it if needed. But thank you all. All right, I'm gonna stop the recording here. I hope you guys all have a great day, and I will hopefully see you soon. Okay, bye.